back into another patient setup bag. So that way you have exactly what you need, and it's going to come just like it would with this. I will also put a filter in the back.
I'm recording it for
because
Eric.
you'll have to use the filter every single time. I'll be using
I'll put it
the
on the
test
thing.
lung. We're not going to use the lung over there. I'm going to use the test lung and kind of simulate compliance and everything like that. Okay, so I'll show you what I mean in just a moment there. So you have, when you first open up this bag, you have this little bag, you have the mouthpiece, the 6-inch corrugated tubing, the neb, and the circuit. And if you guys remember from the last time, it comes with an extra cannula here, and you can take this off, or it might just be in the bag with this, so I'm already taking it off. And you can either choose to take it and toss it, or you can put it back on there and just have it dangling. But I promise you, if you have a piece of extra equipment that is not in use, and you have a patient's family member that sees that, they will ask you questions. Why is that there? Oh, that's broken. And make you be like, no, it's not really broken. We don't really need it. So it's just best to avoid that whole situation to begin with. So now you're left with this and these pieces right here. We're not going to be using the mouthpiece because I'm not going to take a treatment. We're going to use the test lung. So you can take, along with that extra cannula, you can take the mouthpiece and toss it to the side. And now we're left with these. This is going to be the most confusing part of it, okay? And I want to make sure that you guys understand that there might be extra pieces that you do not need to use, okay? If I open it up, there are 3 pieces that come with it. This little white piece, this guy, and this. The one piece that we don't need is this little guy right here. You won't need to use this at all. So you can take this and you can toss it with the mouthpiece, okay? So now you're left with this, the corrugated tubing, the neb, and your actual circuit. Like I said, I will make the filter available for you, so you're going to need to use this. And the way that this is going to be able to be connected, you're going to have to use the white piece first, and you're just going to connect it right inside to the filter side of the IPPB. Okay, go ahead and take your filter and connect it, and that is the first step. Okay, super easy, right? I also will include an extra one of these because we're going to need this in the later setup part. Okay, so that's the first part. Take your circuit, and this can only go one way. Okay, this guy is the whole setup for the nebulizer and the mouthpiece. So this is going to go the far way. That means that this side is going to connect, and you don't want it to touch the ground. First to the filter, and then the nipple attachment that's right next to the tube. Okay, there is another nipple over here, like I showed you before. You don't want to use this one, okay? Just keep everything on that one side. All right, so that's the first part. There are 3 connections to this, right? Or 3 possible connections to where you can put the nebulizer. It is really easy. You don't want air blown into your face, so you can turn this one. This is exhalation. All right, we want the straight line piece to go straight to the patient's mouth. Okay, it goes straight to the patient's mouth. That means that this one, the corrugated tubing that will go to the mouth, goes in the straight line to the patient's mouth. Okay, that means there's only one place left to put the nebulizer cup, and that is right there. Okay, now that's all great and good, but we don't connect just yet, because if we connect just right here, number one, it doesn't work, And if we connect just right here, it fits, but the nebulizer is getting nothing. Okay, so we have to make sure that the nebulizer is getting some of this flow in order to nebulize the medication. So what we're going to do is we're going to take this plastic piece, not the tubing, but the plastic piece, and connect it to the nebulizer. All right, now we have a disconnected tubing right here and the disconnected tubing coming from the actual machine. So again, if we just go with this tubing to this side, yes, it fits, but again, the nebulizer isn't getting anything. We got a loose piece right here. So the really only way to work it is to take that piece that had connected into the nebulizer and connect it right here. And now we connect that extra pressure line tubing right there to the bottom of the nebulizer. All right, and that's it. Okay, does anybody know where we connect? And you're gonna have to connect the right respirometer to this so that you can tell the type of volume that they're getting. And I'm also gonna have you collect the minute ventilation. So we're not gonna look at one breath and say that's the volume. We're gonna look at least 30 seconds and count the respiratory rate. And you should get a minute ventilation from that. Or you'll get a minute ventilation from the right respirometer, and then you'll have your respiratory rate. In order to get a full minute, you have to multiply both by 2. If you prefer, you can watch it for a whole minute. Okay, instead of having to do the math, if you don't want to have to do the math, watch for a full minute and get their full respiratory rate and their full minute ventilation. Okay, once you do that, then you can divide that minute ventilation by the respiratory rate and get your average tidal volume. Okay, does that make sense to everybody? But so part of this, and I know that you guys have already been checked off on it, but part of this is you have to know how to read the right respirometer. Okay, so if you don't know how to read the right respirometer, then make sure that you are practicing that along with this practice for the check off. Okay, so just watch it, watch how the hands move. If it moves really fast, that's going to be the tidal volume. If it moves relatively slow compared to the really, really fast one, that's the mid ventilation one. Okay, because that's just an easy way to kind of remember which hand you should look at when you're getting your mid ventilation. Okay, so that's our setup. If you don't know where to put this, I am not going to go fail. I'm not going to do anything like that. This is only to be able to connect to our, oh, and it doesn't even connect there. Fantastic. What's that? I'm going to cry right now. I'm going to have to get a different connector piece. Darn it.
Eric, you don't need to know this.
Okay.